is Lauren Lyons. I'm a physical therapist at Yale New Haven Children's Hospital in New Haven, Connecticut, and also a member of the Yale Pediatrics CF team. Talk a little bit today about protecting the frame. So the frame is the structure that is most important to protecting all of our vital organs, and how that relates to bone mineral density screening and exercise recommendations in cystic fibrosis. So in CF, why do we care so much about osteoporosis? Osteoporosis is thinning and weakening of the bones. And the Cystic Fibrosis Foundation came out with care guidelines a number of years back, prioritizing the care of bone disease, and indicated that it's a common complication of cystic fibrosis, characterized by low bone mineral density and increased rate or risk of fractures. And the reason that osteoporosis may be more prevalent among the population that has CF can be due to a bunch of factors. So challenges in absorbing fat-soluble vitamins can lead to decreased bone mineral density. Overall decrease in nutritional status can also be a contributing factor, as well as lack of physical activity, as well as that we know there's some conditions that result in increased risk for low bone mineral density, including individuals who have been on glucocorticoid therapy frequently, those who have delayed puberty, and the sort of chronic disease and chronic inflammation can all also contribute to the increased risk for osteoporosis. And osteoporosis has been shown to start in early childhood with a failure of normal bone calcium accretion. So the recommendation is prevention, early recognition, and treatment. And certainly there's going to be an increasing effect as we see more and more people on highly effective modulator therapies. So why do we care about good bone health? What do we need bone health for? And this is just sort of a little schematic of all the things, and this isn't even exhaustive, of course, that we depend on our bone health for. Everything from sitting and standing, running, working, playing, laughing, sleeping well, the ability to stand, stretch, move, lift, exercise, go to school, go to work. All these things depend on good bone health. So in particular, looking at children with cystic fibrosis, there was a study back in 2006 that indicated that CF-related bone disease can begin in early childhood and establish initial guidelines for identifying and treating children who have low bone mineral density. In terms of adults with cystic fibrosis, a couple of different studies indicating that a substantial number of the clinical population showed, when assessed, that they had low bone mineral density, but also that indicating that there's areas where more research is needed to optimize what were recommendations in terms of nutritional and exercise recommendation. And again, a second study, a retrospective study, looked at bone mineral density in adults with CF, and again showed greater than 50%. So to look at the Cystic Fibrosis Foundation's clinical care guidelines, and their recommendation is that DEXA scanning, which is the gold standard for measuring bone density, be completed on all patients greater than 18 years of age, and children greater than 8 years of age if they match any of the following risk criteria: less than 90% of ideal body weight, less than 50% of predicted FEV1, a history of glucose steroid use of greater than 5 milligrams a day for more than 90 days a year, a history of delayed puberty or a history of fracture. And so even though screening guidelines are in place, studies have shown that the screening practices vary widely across adult programs in the US, despite the fact that the CFF recommends screening for all children over the age of 18. An average screening with a retrospective registry review between 2014 and 2018 was about 60%. This was a particular area that we targeted as part of our center, was trying to identify those at risk for low bone mineral density and get more individuals at risk in for screening. And so the CFF also rolled out clinical care guidelines for treatment, depending on what the T or Z score from the DEXA scan showed. All individuals who had some level of risk for bone disease were encouraged to improve their nutritional status and target BMI at least above the 25th percentile, optimize vitamins in particular of D, calcium, and vitamin K, encouraging weight-bearing exercise and repeating every 5 years. So our more at-risk individuals, the other recommendations in terms of care guidelines, we're being even more aggressive in terms of managing pulmonary infections, minimizing steroid use if possible, making sure that CFRD, delayed puberty, or hypogonadism were all treated, making sure these individuals got an endocrine referral to consider bisphosphonate therapy, and those who are at more risk for low bone mineral density would repeat the DEXA scan every 2 to 4 years. And those at most risk would actually have their DEXA scan repeated annually. So I'm a physical therapist, so exercise is always high on my radar list. And the care guidelines are relatively vague. Weight-bearing exercise is what's included in the recommendation for management. And so what does that actually mean? What good is it for us to screen without having good ideas for interventions? And what does weight-bearing exercise really mean? So the next couple of slides, I'm just going to go through some of what the recent literature is. And I would highly recommend anyone who is living with cystic fibrosis to make sure you're screened according to the guidelines, and then talk with your clinic team about what your results were and what that might mean to you in terms of exercise, nutrition, and endocrine management. So again, we get this vague statement, should participate in weight-bearing and resistance exercise, but what does that really mean? So if we look at the literature for exercise in adults with CF, the studies have shown that body mass index and time spent in moderate physical activity correlated with improved femoral neck bone mineral density in both adults and adolescents with cystic fibrosis. And so a couple of other studies had also shown that those individuals who report greater physical activity or greater physical exercise capacity also correlate with increased bone mineral density. And there have not been any randomized control trials showing the direct benefits in CF bone disease, but so we're going to extrapolate some data from some other studies in the non-CF population. So looking at exercise in the general adult population, exercise regimens twice a week, 30 minutes, 5 by 5 reps of more higher intensity showed improvement in bone mineral density versus a low intensity program. And that was a study looking at postmenopausal women. There were some studies indicating that walking alone, swimming, the less intensity of weight bearing does not assist with increasing bone mineral density, and that high impact exercise was more correlated with significant changes in lumbar, that's the back, and femoral, that's the hip, bone mineral density. So again, most of the studies that have been done about bone mineral density are in postmenopausal women, so we're extrapolating a little bit here. But the general principles to assist with bone stimulation, again, this is in studies for postmenopausal women, indicated that walking and cycling had little to no effect, and that high stress loads, such as jumping, plyometrics, and gymnastics, uneven loading, so anything where there's alternating legs or hopping, and shorter multiple sessions with multimodal or a variety of different types of exercises had the best effect. And how about in children? A literature review in 2008 indicated that there was a lack of evidence concerning exercise for bone health in children with CF, in an area that, again, more research needs to be done. But in looking at the non-CF pediatric population, there was a randomized control trial of 50 children in 2019 that looked at exercise over a 12-month period, and that did not show a significant difference in bone mineral density with that exercise, but the exercise itself was not defined, so it's hard to know whether it was intensive enough of bone loading to show an improvement. Overall, there were improvements in exercise capacity, quality of life, and vitamin D. And then looking at some school-based children, there was a review that pulled together 17 different studies, all looking at school-based jumping types of interventions in the non-CF population. And in 15 of the 17 studies, there was improvement shown in bone mineral density at, again, those higher ground reaction forces. So those high impact, high intensity, jumping, hopping, skipping, those kinds of activities showed a much greater increase in bone mineral density. So what do we have to be careful of? Certainly we know that anyone who has is at more risk for fracture or has lower bone mineral density needs to be careful to avoid deep flexion and lifting, as well as high impact movements that have a twisting moment. So the straight up and down impact may be fine, but if you add a twisting component, that's much higher stress to the bone that may result in a fracture. And so what this emphasizes is that really anybody who's at high risk needs to have appropriate guidance, do a session or two with someone who can observe your form and make sure that you're doing things correctly so that you don't end up inadvertently hurting yourself. The other thing we need to be careful of is high impact exercise is very hard on the pelvic floor. We know that the individuals with cystic fibrosis are already at increased risk of having stress urinary incontinence due to repetitive coughing and stress on the pelvic floor. So high impact activity is something that also can increase stress and we need to be careful of. So it's very important that your exercise program also have an element of core stabilization, and that you work with a physical therapist or with your clinic therapist to teach you how to do kind of a pelvic lift or pelvic brace prior to stress maneuvers, and make sure that you're not holding your breath to help to support your pelvic floor when you're under more of a stress maneuver. And again, these all sort of point to the importance of physical therapy referrals for exercise guidance and recommendations. And if your clinic doesn't have a PT, talking with your clinic team about if you can get a referral to a physical therapist to help you, just make sure that you're doing things safely and correctly, and you're getting the most bang for your buck. And then a glimpse of the future now that more and more individuals are able to be on highly effective modulators, that we know that modulator therapy is linked with improved quality of life and longer life expectancy. So that's so exciting, and we're thrilled to be a part of those huge steps forward. But that does mean we also may run into some more secondary complications or chronic complications. CF bone disease would be one of those that we just need to make sure that we screen for early, because there is more of a risk that will be something that we run into down the line. And certainly we want to avoid fractures, pain, and disability. And there is some thought that restoration of the CFTR may help to improve bone health, either directly at the bone or indirectly by improved lung and nutritional health. So that's super exciting. So what's the take-home message today? If you don't screen, you'll never know. So if you haven't already, make sure that you talk with your clinic team about getting screened for bone mineral density. It is a painless screen. It's low radiation, and it's a quick procedure. And then once you have been screened, realize that there are specific targeted exercises that may be the best in terms of bone stimulation. Those often are things that can be done relatively quickly because the emphasis is on a high stress load, uneven loading, and sort of quick bursts of activity. So in our clinic population, we found that that's been easy to roll into an airway clearance regimen. So adding into huff breaks or at the end of treatment, a little bit of plyometric or some jumping activity with the added benefit that also helps to enhance any sputum clearance. Again, really important that particularly those at high risk get a referral for physical therapy, just to, again, make sure that your initial regimen has someone taking a look at your form and making sure that you're protecting your pelvic floor because correct form is really key. So thanks very much for listening to a little bit about bone health and cystic fibrosis and why it's important to get screening appropriately and then to get exercise as part of your regimen if it's not already. My email address is on the bottom of the screen here. I'm happy to be reached out to with any questions regarding this presentation. It's lauren.lyons@ynh.org. Thanks so much for your time and have a great evening.